Hi, I'm Anna Denton-Jones, and in today's session, I would like to talk about a practical issue rather than a technical legal point, and that's around working from home and ill health. So, a year ago, we pivoted to more people working from home, and most organisations probably haven't done a great deal to update their sickness policy or think around the issue beyond tackling obvious COVID related points. But prior to the pandemic, we knew that working whilst you were ill was not necessarily a good thing. Presenteeism is something that every year when the CIPD do surveys, they always measure whether they think presenteeism is going up or down. And certainly when people are in an economic climate where they learn that redundancies, matrices for redundancy might include absence, sometimes we can see presenteeism increasing. But it can be problematic as people are bringing their germs into the workplace, and that got put into sharp relief with COVID, where we learnt that there were a whole cohort of workers who could not afford to not be in work. They didn't have decent sick pay, they were on low incomes, and that was a huge influence in terms of the spread of COVID and low paid workers coming into work with symptoms. But a presenteeism culture can be negative for other reasons. So there have been studies that have been done that suggest that the actual negative effects to productivity can be greater through presenteeism than actually if the person took the time off that they needed to recover. There are also studies that have shown that it increases people's stress levels. It can lead to higher levels of anxiety and ultimately depression. So lots of reasons why businesses need to be thinking about what messages they send people. And I think with people working from home, it can be very tempting to work on through. Maybe you don't work as hard on the days that you're not feeling well, but nevertheless, you're still there, you're still answering your emails, you're still attending the Zoom calls. And actually, we need to have a culture where we're saying to people, if you aren't well, it is acceptable for you not to be working. So do our leaders in the organisation set a good example themselves, or are they to be found on calls and on Zoom when they're themselves sniffling and under the weather? Are we setting the right examples where if somebody needs to have, for want of a better expression, a mental health day, or some kind of personal and emergency day, are people setting the right examples around those sorts of things and admitting that they need to take a break because they're suffering, and sending the message to the rest of the organisation that can be done? Are managers empathetic if somebody calls in sick? Have managers had conversations with their teams about the temptation to be present in work when you're working from home, and how that might not be a good idea if you're not well? Simple things that organisations can be doing to send the right kind of messages to people. I think one of the other things that perhaps has happened during COVID is that if we have known people perhaps be hospitalised, very seriously ill with COVID, maybe a colleague, maybe a family member or friend, it recalibrates our attitude towards other more minor illnesses. And there is a temptation, I think, for us to now look down on more minor complaints and illnesses as a result. And I think we've got to be checking our tendency to do that, and remembering that there are lots of different reasons why people might need to have a break from work and recover, and making sure that our sickness policies encourage that rather than spiraling into a negative situation. If anyone's got any questions, please do email me. It's adnton@refreshinglawltd.co.uk, and I look forward to speaking to you again in another session.